Welcome to the parshealthTV channel. We hope you're having a good day and you are happy and healthy. In this channel, we give you tips to keep you healthy and out of trouble. In this video, we want to have 7 minutes about prediabetes symptoms and causes. This video is for educational purposes only, and if you have any specific condition or illness, you should consult with your doctor. Diabetes is a metabolic disease that influences the body's sugar usage when the body cannot take up glucose, sugar, into cells. Glucose is a necessary substance for our body. It is vital to make muscles and tissues. It's an essential source of brain fuel and the primary source of the body's total energy for its daily functions. When you have diabetes, the hormone insulin, which is made up of the pancreas, is not made in your body, or your body cannot use it effectively. Insulin is responsible for moving sugar from the blood to the cells to use it as fuel or store it. So, with diabetes, your body cannot make or use insulin to break down glucose molecules, and extra sugar will build up in your bloodstream. If you like topics like this, make sure to subscribe to our channel and press the bell icon to see daily videos just like this one. Alright, let's get started. There are several types of diabetes. In this video, we are going to be introducing prediabetes and its symptoms and treatments. If you want to know more about other types of this disease, there are videos on our channel about this topic. You can check them out. Prediabetes. Prediabetes is a condition in which the blood sugar level is higher than normal and lower than what is considered diabetes. If left unchecked, it can lead to type 2 diabetes, heart disease, and stroke. According to the World Health Organization, NIH, prediabetes is reversible. Treatment includes lifestyle changes such as diet, exercise, and medication, which will lead to diabetes if the person changes their lifestyle in the next 10 years. Symptoms. Some symptoms are common in diabetes, such as feeling thirsty, unusual weight loss, increased hunger, unexplained numbness in feet or hands, frequent use of the toilet, especially at night, and blurry vision. Tiredness, fatigue, and slow healing of sores are also other symptoms of diabetes. But it is very dependent on how high your blood sugar is. In type 1 diabetes, these symptoms are severe and show themselves quickly, as several weeks. But if prediabetes leads to type 2 diabetes, it can develop very slowly, maybe for several years. The dangerous fact is that it's so slow that you may not notice until it becomes developed and dangerous. As this kind of diabetes is an autoimmune system disease, its cause is not apparent. Many scientists believe that the main reason for type 1 diabetes is genes and family history, but environmental factors are also important. One of the differences between type 2 and type 1 is that obesity is not related to type 1 and isn't considered a factor. However, other factors like injury to the pancreas by infection or tumor, presence of autoantibodies that attack body organs, tissues, or cells mistakenly. Although prediabetes has no specific symptoms, each person experiences some of them based on their circumstances. For example, people with the disease may experience symptoms associated with insulin resistance, including polycystic ovary syndrome and acanthosis nigricans, darkening and thickening of the skin in various parts of the body. Infectious symptoms include increased thirst, increased urine volume, fatigue, blurred vision, and slowly healing ulcers. What causes prediabetes? The exact cause of it is unknown. However, scientists believe that these factors can increase the risk of getting it, such as family history. Having a parent or sibling with diabetes can raise your chance of having it. Obesity. Suppose you have extra weight and are physically inactive. In that case, you are more likely to develop type 2 diabetes because the excess weight may cause insulin resistance. Therefore, it is essential where your fat is stored. Belly fat is mainly linked with insulin resistance. having high blood pressure or a history of heart diseases in you and your family, and smoking. Although the exact reason for diabetes is not apparent for anyone, these environmental factors can influence the risk of getting it. The hormonal disease can also cause diabetes because when the body produces too much of a specific hormone, its side effects are insulin resistance in the body. Medicines. Some medicines harm the body's beta cells responsible for producing insulin, such as anti-seizure drugs, psychiatric drugs, anti-rejection medicines, and statins that can protect you from heart diseases and heart attacks to decrease bad cholesterol levels can slowly develop your insulin resistance. All kinds of diabetes are dangerous and life-threatening diseases. Suppose you ignore your symptoms and your diabetes develops into a necessary condition. In that case, it will cause many severe problems for your health. On the other hand, most diabetes types do not have so many symptoms, so take a blood test twice a year and check your health. In this stage, you can have only a high blood sugar level, not the other symptoms of diabetes. This kind of diabetes is treatable by medical procedures, and it can last for several months or years. People with prediabetes are mainly around the age of 20 and older. You can control this type with a healthy lifestyle and some medication. However, if you ignore it, it develops into type 2 diabetes. Share your experiences with diabetes and its symptoms with us in the comment section below. If you are interested in videos like this, make sure to like this video and subscribe to our channel. We hope you have a wonderful day. See you in the next video.